Hello all, welcome back to Answer Writing Initiative at 9 p.m. I'm Guna Mathivanan from Officers IAS Academy. Friends, targeting 2024 prelims as well as mains, I'm coming up with an exclusive current affairs program. I have given the information about the program, you can go through if you are interested. Right. So, I gave question related to antimicrobial resistance. Antimicrobial resistance remains the threat to global health and development. Elaborate the causes of antimicrobial resistance and suggest control measures. So in this answer, we have 15 marker question. So we are explaining about what is antimicrobial resistance. Then we will explain how it is a threat to the global health and development in general. And you elaborate the causes for this antimicrobial resistance and suggest control measures. Antimicrobial resistance, what is that? Highlight the threats, highlight the causes, and also suggest some measures, preventive measures, conclude it. Right? So, antimicrobial resistance, it's a situation where the microorganisms like bacteria, fungus, virus, they change over time and they start showing resistance to the medicines. So I take an antibiotic. I have bacterial infection in my body. I take antibiotics. So why it is called as antibiotics? It will kill bacteria. I take antibiotic to kill bacteria, but the bacteria is showing resistance to that antibiotic. So I take drug, but the drug is not able to kill the bacteria because the bacteria over a period gained strength and they are showing resistance to the drug. If it starts showing resistance, if bacteria is showing resistance, virus is showing resistance, fungus is showing resistance to the drugs which we eat, when we take, if that is showing resistance, what will happen? That will become a threat. The infections becomes incurable, or it becomes difficult to cure the infection. Sometimes it cannot be cured at all. So it is obviously a global threat. Today we see a rise in antimicrobial resistance because of various reasons. There are a lot of causes we will discuss. But look at the threat. Just now we saw how COVID caused immense damage, economic damage, health damage. It was affecting us psychologically, mental damage, physical damage, material damage. Right? So you can highlight some threats, you can highlight some facts. You can mention about the number of death it kills. Antimicrobial resistance directly kills 10 lakh people approximately in a year. Indirectly, it kills around 50 lakh people in a year. WHO has declared it is one of the top 10 public, global public health threat. Right. So, mention some threats, mention some damages in terms of health, in terms of wealth. Okay, that should be your introduction part. So, introduce what is antimicrobial resistance and how that is going to create a threat, what kind of threats. It affects the animal health, it affects the human health, it affects the biodiversity. This is going to result in more number of infections, that is going to result in more out of pocket expenditure, that is going to affect the economic growth, that is going to affect the individual consumption behavior. All the nation's resources will be directed for tackling this health emergency that can bring in widen more inequality. Like this, you can mention the threats, whatever threats you want to highlight, 4 or 5 threats you can highlight. Either put pointers or as a part of introduction also you can bring the threats, no problem. Now, what is the causes? That we have to list out. WHO has clearly given what are the causes for this antimicrobial resistance. Causes is very simple. Overuse of drugs, incorrect usage of drugs, higher dosage of drugs. When we go to doctor prescribes medicines. Doctor prescribed medicines for 5 days. That means we have to consume it for 5 days completely. When doctor gives medicine, what we do? We go to medical shop, we buy it only for 2 or 3 days. Incorrect dosage. Doctor asks us to buy and have it for 5 days, but we have it for 3 days or 2 days. We will get symptomatic relief. That's all. That is not cure. That is not cure. So we have to take the correct dosages what doctor prescribes. Sometimes what happens? We directly, when we have some, let's say I have headache, I have stomach ache, I go to medical shop, I ask directly from the medical shop some medicines. The medical shop practitioner is not a doctor. The medical shop practitioner, I mean the pharmacist, will be giving some amount of dosage. It can be overdose or it can be incorrect dose, self medication. All these are problems. Poor access to clean water. When you are living in an unhygienic environment, if there is no proper sanitation facility, that can also result in thriving of such stronger microbes. Poor enforcement of legislations. There are legislations. Let's say, for example, if you take Indian government has something called as red line campaign. That means to prevent the overconsumption of serious antibiotics. What Indian government did, they came with a red line campaign. In the drug, a red line will be marked. If it is marked, then such medicines you cannot purchase through over the counter without prescription. Without prescription, you cannot purchase. So through this, government is trying to limit the sale of antibiotics. Because what happens, we go to medical shop, we buy whatever antibiotics we want. Just like that, we are able to get the access, and that is resulting in overdosage or incorrect dosage of antibiotics, causing antimicrobial resistance. So Indian government has a red line campaign to limit the sale of these drugs over the counter. Government has a red line campaign. We have an legislation, but it is not enforced properly. In India, medical shops, practically you can buy most of the drugs. So WHO says all these things: incorrect dosage, overuse of drugs, self-medication, poor access to clean water, improper sanitation condition, improper hygiene environment, right? Poor enforcement of legislations, lack of affordability of drugs. Drugs should be affordable. If the drugs is very costly, then people will not buy. So all these points are causes. We can mention these are the causes for rise in antimicrobial resistance, frequent use, overdosage, etc. Any other points you want, you can add, no problem. There is no one correct answer for any question. I have listed out what WHO has said as the causes for the rise in antimicrobial resistance. Then you have to mention about the control measures. Control measures taken. See that in Indian government's initiative of red line campaign, that itself is a control measure which you can mention. Or the WHO's GLASS initiative. That is Global Antimicrobial Resistance and Use Surveillance System. So we should have a proper surveillance system. The government should have a surveillance system. These antibiotics are used in excess in poultry farming. These antibiotics are used in excess when there is more access to self-medication. So we need an intelligence network. We need a surveillance system which prevents the use of antibiotics in excess. Usage of antibiotics is not wrong, but when you use it in excess, that creates problem. So proper legislations are required. Proper surveillance system is required. Public should have awareness. Right? Government should spend money on research and development, should motivate private to spend money on research and development to find out a solution for such stronger superbugs. Superbugs means those bacteria, those microorganisms which shows resistance. We have to kill that also, right? So parallelly, we should also spend some money, research and development for developing medicines to cure that. Improve the infrastructure, improve the primary healthcare centers. Government should improve the health infrastructure so that at early stage we have to find out such resistance and we have to kill it at the entry level itself. So government should improve the infrastructure. So all these are preventive measures which you can highlight. Any other point if you want, you can highlight, no problem. Then finally conclude. So this is a global challenge. It is not a localized challenge. What is required is a collaborative effort. We need a coordinated, cooperative effort, not just within the government, between the governments, between the country and within the country. Right? We need multi-stakeholder participation to fight this global threat called as antimicrobial resistance. So these control measures has to be taken seriously and has to be implemented with fuller participation. Like that you can conclude. Very easy question. Mains answer writing is not that challenging. If you understand the knack of writing, with limited substance also you can develop answer. But what is required is the flow. That flow is what is more required. Okay. So here I have given a model answer about introduction and threat. I have given here in paragraph format. Then I have given the causes. Then I have explained the control measures. Please explain the control measures. That is how this measure is going to control. If government is going to improve the infrastructure, health infrastructure, how it is going to prevent? Right? That link point you please give it. Through red line campaign, government is limiting the spread of overuse of antibiotics. To surveillance through surveillance program, government will try to have a check on excess use of antibiotics. Like that, you explain, right? Then give a simple conclusion. Many students have not focused on this threat part. This threat part was not focused much, though it is not explicitly mentioned. At least give 3 4 points related to threat. Okay. Other aspects it was fine, but not many wrote good answers. Many were deviating. They were explaining the antibiotic resistance in detail. Right, like how I have discussed in class, they are giving that similar examples. Class is different, writing answers is different. Okay. So Pavitra, yes, you have given a neat introduction, but the threat part is missing. Please add it. Causes of AMR you have explained well. Excessive usage of antibiotics. You don't say just usage of antibiotics. Say excess usage of antibiotics in poultry. Limited use is not a problem. When you go for overdose, that becomes the problem. Yes, release of untreated industrial effluents. So polluting the water bodies can also be a place where these microorganisms can breed. So lack of clean hygiene drinking water, lack of infection control mechanisms in the hospitals. Okay. So control measures you have mentioned about awareness, regulating the sale, research, diagnosis, infection control and prevention. Yet your presentation is also neat. What mistake you have done? So here you have mentioned about the control measures and you have suggested way forward. This way forward is also control measures. You have mentioned about one health approach. Good. One health. What is one health approach? Treating human health, animal health, environmental health together. That is one health approach. That is important. Yes. So these way forward and the control measures can be brought together. Right? This government initiatives and everything, all these three can be blended together. Right? Finally, you have highlighted the economic impact and they have concluded. Good answer. Very good answer. Then Vinayak, antimicrobial resistance refers to a condition. Yes, fine. It's a top 10 global public health threat. Okay. Threat aspects you can slightly expand. Causes, genetic changes, overuse and misuse. Please block it or please underline so that it becomes easy for the evaluator. Overuse, right? Faulty use of medicines, this incorrect dosage, inadequate usage, lack of access, poor infrastructure, lack of awareness. Yes. Control measures, yes. One health approach, fine. Just now I explained what is one health approach. Improving the infrastructure facilities. Glass, you have mentioned, great. Global action plan on antimicrobial resistance, okay. Aware tool, okay. Aware tool you have written. How aware tool is going to limit the usage of antibiotics? That you have not explained. Aware tool is a tool of WHO where the antibiotics will be divided into 3 lists: access list, watch list, reserve list. Those antibiotics which is coming under the access list, which should be available in all healthcare centers. It should be accessible. Whatever antibiotic should be accessible should be given to this access list. Similarly, we have watch list, reserve list. Reserve list, whatever it is in reserve list, only in extreme situation you have to use it. So this ABAT tool classifies the antibiotics into 3 categories, which is helping us to limit the usage of antibiotics. Ultimately, overuse of antibiotics creates the problem. That has to be limited. Appropriate use has to be promoted. How aware is going to help it? That you can mention. Conclusion is fine. Okay, Dharmavarshini. Dharmavarshini, you have clearly mentioned about threats. Good. You have mentioned about threats, you have mentioned about causes, you have also mentioned about the control measures. The points are similar, so I am skipping it immediately. I have read your answer already. Your answer is good. Your answer is good. Right. Dharmavarshini, you have done well. You have given a brief intro. You have explained the threats. You have also given 5-6 points for causes, and also you have given similar 5-6 points for control measures. Right. Great. So, right. So, what is the question for today? What do you understand by the term urban heat island? Analyze the cause of urban heat island and potential mitigation strategies. What do you understand by the term urban heat island? Analyze the cause of urban heat island and potential mitigation strategies. That's all. Simple question. 10 marker question. Right? So, I hope this answer writing initiative is useful. I will see you in next video. Till then, bye. Take care.